Next will be Roberta Lynch from AFSCME Local Council 31, longtime labor and social justice activist who has shared many struggles with Quentin.
You know, there are so many people here tonight who've known Quentin longer than me and better than me. I'm here basically because of what you heard in the film when Quentin talked about the effect that the struggle in the steel industry had in shaping his whole life, because his life has been linked always to the struggles of workers in this country. And it occurred to me as I was thinking about what to say tonight that it was almost exactly 2 years ago to this day that I was standing on a stage with two of my personal heroes, then Senator Barack Obama and Dr. Quentin Young. And we were there together in support of thousands of workers who are seeking to organize a union with AFSCME to try to gain a voice on the job at the 8 affiliated hospitals of Resurrection Healthcare here in the Chicago area. And the workers who spoke that day told of Resurrection's aggressive anti-union campaign, of their co-workers who had been harassed, intimidated, even fired for daring to express support for the union, and of the fear that now permeates their work sites. In the 2 years since that day, Barack Obama has overcome what some thought were insurmountable obstacles to become the President of the United States of America. But you know, the workers at Resurrection Healthcare still don't have a union. They still don't have the right in any meaningful sense to organize a union. And the legislation that would give them that right, the Employee Free Choice Act, has become the #1 target of big business in this country. I tell you this to give you some idea of how radically the deck is stacked against workers in this country, how hard the struggle is to alter a balance of power that has shifted so profoundly and completely to employers and the corporate class, and how vitally important it is that the labor movement and America's workers have friends and allies like Dr. Quentin Young. As you heard Quentin say, his commitment to workers has been lifelong, and I'm sure there's so much about it that I don't know, but I want to say just a little of what I do know from my own experience. I came to Chicago in 1975, and that year happened to coincide, that was the year that the house staff at Cook County Hospital were in the process of staging what was one of the first strikes of doctors in the modern era, a strike that was basically about improving quality of care. That strike was the way that workers had of expressing their concern about the lack of quality care in that setting. It's the same concern that is motivating workers at Resurrection Healthcare to organize today. And Quentin was effectively, at the time, sort of their boss. He was, and while he didn't actively support the strike, when he refused to go along, when he was asked to be complicitous in punishing the strikers, and as a result of his courage in doing that, he was fired from Cook County Hospital. Was that the first or the second time? During that same period, Quentin took a very innovative step. He saw the extent to which workers were exposed to hazardous materials and conditions on the job, robbing them of their health, and at the same time were at the mercy of company doctors who had a self-interest in denying the scope and the cause of their injury. He founded one of the country's first occupational medicine programs that provided technical training to doctors regarding the hazards that workers face, but also provided ethical training to doctors about the responsibility of physicians to expose the links between workplace hazards and illness. And by the time I went to work for the Chicago Area Committee on Occupational Safety and Health in the late 1970s, those young doctors that Quentin helped to train were playing a critical role in the efforts to combat occupational disease in this city and around the country. In the 1980s, when I went to work for AFSCME, which represents nearly 1,000 support staff in the Cook County healthcare system, our union worked with Quentin and so many of you here in so many battles to preserve vitally needed funding for public health services, to prevent the privatization of public health, to build a new Cook County hospital, and to help make that hospital and all the clinics and the other hospitals that are part of that system one of the nation's, if not the nation's at that time, premier public health care system. And by the way, a system in which virtually every worker, including now physicians, have union representation. It was a system that functioned remarkably well under often straitened circumstances over 2 decades until a few years ago when it was thrown into utter chaos and near collapse by a change in leadership, a disastrous change in leadership. Quentin had already been long retired from county, but in the face of this new threat, he didn't hesitate. When the unions representing county workers joined with concerned advocacy groups to form the emergency network to save county health services, Quentin was in the forefront of that fight. A fight which wasn't easy, it was a tough fight, but it resulted in new independence governance structure. It drove out the leadership that was trying to wreck the hospital and put new leadership in place. And now there's a basis, we haven't solved all the problems, but there's a basis to continue building and go forward thanks to his efforts. This I know about Quentin Young. You don't have to knock twice, sisters and brothers, when there's a fight and you need help. When that struggle was going on at County Hospital most recently, or Stroger Hospital as they say now, some of us can't adjust to that. When the resurrection healthcare workers needed Quentin's help, they didn't have to ask twice. He was there, as he's been there time and again, when workers have stood up for their rights and needed support and allies. Quentin likes to tell folks that he is a dues-paying member of AFSCME, our retiree chapter. In the labor movement, we believe strongly in paying your dues. And the fact is that Quentin Young is more than paid up. He's paid his dues to some, probably most all, of the greatest causes of our time. The battle against racial injustice, the struggle of workers for dignity, the protection of civil liberties, and of course the greatest cause of his life, the right of every single person in this country to quality health care. For all of that and for so much more, we are in his debt. Thank you, Quentin Young.